My name is Dr. Alex Reddy. I am a 2024 graduate of the Virginia, Maryland College of Veterinary Medicine, and I am now a second-year anatomic pathology resident here at the college. So pathology is the study of disease. It's the who, what, where, when, and why of disease. And so in my training, I'm going to be a veterinary pathologist who will diagnose why animals died, giving owners clarity of what happened to their pets. We also evaluate biopsies from masses on your pets to figure out is it cancerous, inflammatory, etc., to work directly with your clinical veterinarian to help give your pet the best life that it can. So blue-green algae refers to these harmful algal blooms that are caused by bacteria known as cyanobacteria. And these cyanobacteria produce toxins that are toxic to animals, including pets, livestock, wildlife, and even people. So blue-green algae poisoning is a concern to our pets because the toxins target the liver and the nervous system in particular and can be rapidly fatal. So blue-green algae loves warm water that is stagnant, murky, and rich in nutrients. So blue-green algae are going to be most abundant in these warmer summer months when the water is rich in nutrients from fertilizer runoff or manure runoff, but you can also find them after a dry spell when there's been limited rainfall. They're going to be the most concern in the summer months, and so you'll want to look out for them in freshwater sources such as ponds or lakes, but you can also find them in saltwater and brackish water, so these are a mixture of those ecosystems, and so they can be present in those throughout the year, but particularly high during the summer. Our pets become most exposed through the oral route of exposure. So this includes directly ingesting contaminated water, ingesting the algal blooms on the water, and even eating contaminated debris and fish carcasses. And then if they're swimming in the water, they can also ingest it by licking their fur, licking at their paws, and something else that isn't often talked about is animals can become affected if they ingest contaminated blue-green algae dietary supplements. So there have been some studies, mainly in laboratory animals, that have looked at a dose-response relationship, and for example, they've shown that just a 60-gram dose is enough to kill a 50-pound dog. So ultimately, it only takes a few mouthfuls of contaminated water or debris for an animal to experience toxicosis, and it is rapidly fatal. Within 30 minutes, signs can happen. The algal blooms also that they float on the surface of the water often, and so they can be blown by the wind and go to the shorelines, and they've shown that those really thick concentrated mats along the shore have the highest concentrations. Makes sense. So from a pathology perspective, what's happening inside your pet's body when they ingest the harmful algal blooms, it does depend on which toxin is ingested. So the main two toxins are called cyanotoxins, and one targets the liver and one targets the nervous system, so your brain, your muscles, and etc. And if the hepatotoxin, so the toxin that targets the liver, is ingested, then it damages the liver and ultimately animals go into liver failure. If the nervous system toxin is ingested, this targets the nervous system because it, one, mimics this important signaling molecule or neurotransmitter that our body needs for causing muscle contractions. So it mimics that action, and then it inhibits the breakdown of that neurotransmitter. And so ultimately, you just get excessive concentrations of it, and so you get excessive muscle contractions that progress to paralysis, including paralysis of the muscles required for breathing. So in these cases with the neurotoxins, the animals ultimately die from respiratory failure, and all of this can happen within the body within 30 minutes. So in the emergency setting, the diagnosis is largely based on the living animal in front of you. So the clinical veterinarian is going to do their diagnostic testing based on the clinical signs of the patient and the history that they gather of potential exposure. And so the testing in this sense will include blood work, looking at clotting times and other derangements in the body so they can help understand what's going on in the patient. The water source that the animal became exposed to can be tested for the presence of toxins, and also in the living animal, if the patient is caught early enough in exposure and they're stable, they can induce vomiting, and those stomach contents can be tested for toxins. If unfortunately the animal passes away and makes it to autopsy, or what we call necropsy for animals, then we can also obtain those stomach contents, but then we have the privilege of getting the actual tissues, particularly the liver, to submit for toxin testing. Because blue-green algae poisoning can be rapidly fatal, it's really critical that pet owners not wait until clinical signs develop to bring their pet to the hospital. If you have any suspicion that your pet has been exposed, you should immediately rush them to your nearest veterinary hospital. And if you have time and access, if you know they've been swimming, then you can really quickly bathe them with clean water and then rush them to the hospital. When our pets get out of the water, they often want to lick and clean themselves, and that's just an extra level of exposure, so we want to minimize that. So unfortunately, there is no specific antidote for blue-green algae poisoning, and so the initial treatment is largely supportive care. And this also depends on which of those two types of toxins are ingested. Is it the liver toxin or the neurotoxin? Because the treatment's going to vary specifically based on those. But in general, the supportive care is going to include decontamination, like I mentioned, with bathing your pet, and if they're stable, vomiting may be induced. But otherwise, IV fluid support, electrolytes, glucose. As I mentioned, they can go into respiratory distress, so your pet may get oxygen support. If they're seizing, there can be anti-seizure medications and other interventions that in the moment your clinical veterinarian will use their best judgment, and the treatment plan will change based on how your pet progresses and with close monitoring. So the most important preventative measure is to restrict your pet's access to warm, murky, stagnant water. And so you should maintain your pets on leashes if you're going to be near these sources of water, so that they don't swim in or wade in or drink from. Or if you're walking them along the shoreline, you want to prevent them from eating the algal mats or debris and fish carcasses that could be contaminated. You can also prevent it from happening around your own home, because if you have bird baths and fountains and old potted plants that accumulate warm, stagnant water, those are other sources of exposure. So those are things you can do at home. And I totally understand wanting to take your pet on these adventures with you. And so if you take these precautions, you can help safeguard your pet. And if they do get exposed, or if you are somewhere and you're wondering if that pond has blue-green algae blooms, you want to look. They often form these thick mats or layers of foam on the surface that have this blue-green appearance, as the name implies, but they can also be a little more red-brown, and they can be below the surface that you may not see as well. And so just because you don't see thick layers of algae on the surface doesn't mean it's not there lurking below, and you can't tell from the naked eye if that bloom that you see is toxic or not, and so it's just best to assume that any algae you see is toxic to your pets and not let your pet access it. So safe water sources for your pet are things that are filtered, or your clean backyard pool, or a more rapidly flowing stream or creek than a stagnant pond or lake. But even these things like a stream or a creek, unfortunately, still carry other risks with infectious disease from wildlife feces runoff that may have parasites. So it can be frustrating because everything comes with a risk sometimes, and so ultimately you want to try to make the best informed decision that you can for your pet. And if you avoid those stagnant bodies of water, go with a more rapidly flowing or your clean pool, then your pet can have a safe, cool experience in the water this summer. Veterinarians and veterinary pathologists play a crucial role in public health surveillance, and that includes with blue-green algae poisoning. So as veterinarians and veterinary pathologists, we are trained to be at the forefront of One Health. And so this is that interconnectedness between human health, environmental health, and animal health. And so the clinical veterinarian is really that first line of defense there, because they see your pet firsthand in that emergency setting and determine blue-green algae poisoning based on their clinical signs and deciphering the history of exposure. And then the veterinary pathologists step in as like the detectives to help put together the story based and bring in expertise on diagnostic testing and toxicology. And so based on the patient's clinical picture and the diagnostic testing results, and if they make it to necropsy, the changes in the tissues that we see on the floor and under the microscope, we can work together to solve this mystery and diagnose blue-green algae poisoning. And then we can work together with public health officials to tackle this issue. And so the veterinary pathologist, the clinical veterinarian, and any public health relevant agencies, we can form an integrative team, a One Health approach to safeguard our pets and the public. So thankfully, there are resources a little bit at the national level, at the state level, and at the local level. And so specifically in Virginia, the Virginia Department of Health has this harmful algal bloom dashboard that their task force regularly updates, and they have a map that includes any reported algal blooms in our area and any of those that are still under investigation, but it does not include those that are on private water bodies. So otherwise, the map will include every other water body that's been reported and under investigation, and they'll have local advisories and warnings that you can look at before you take your pet on an adventure. And the Virginia Department of Health, also on their website, they have this online reporting form and a hotline that if you are concerned about the water source that you are located at, you can report this. And through the hotline in particular, it allows them, if there's been human or animal exposure and associated illness, they can contact the Centers for Disease Control and Prevention so that they can be appropriately informed. And the Virginia Department of Health also works locally with the New River Health District, the Virginia Department of Environmental Quality to help do testing, U.S. Forest Service, and just other relevant agencies. So very grateful that we have that role here in Virginia and support for owners and alike. So I will preface that I don't spend as much time looking into the human health risks, but my understanding in my research is that it's a similar level of risk with exposure and fatality in humans as well. And so for the pet owners and the clinicians, they actually advise to, you need to immediately wash your hands if you're handling pets, not touch your mouth and your eyes and your mucous membranes, put on clean clothes if you've been exposed. So we actually need to take similar precautions as our pets because it can be fatal to us as well. So my goal is to help empower owners with the knowledge necessary to protect their pets the best that they can. And I know we covered a lot of ground in our discussion today, so if you just take away one message, let it be this, that it's best to assume that all algae that you see is toxic to your pets, and therefore do not let your pets near it. But if they are exposed, do not wait for clinical signs to develop. Rush them to your nearest veterinary hospital immediately.